So having healthy gums is incredibly important for actual whole body health. We have seen it with kidney health, with heart health, with pulmonary health. It's almost ubiquitous. If your teeth are a mess, your body is going to be a mess.
Are you struggling with low energy, weight gain, hormonal imbalances, or heavy metal and mold toxicity? Do you want to learn more about anti-aging tips and creating more longevity in your life? Well, you're in the right place. Hi, I'm Jen Heller, a wellness educator, infrared sauna expert, and home health consultant. In this podcast, Homes That Heal, I will teach you how to transform your home into a health and wellness sanctuary. Your health is your wealth, and I believe that your home should be your sanctuary space, loaded with the tools you need to thrive in your life, not just survive. If you want to feel fantastic and transform your life and home, grab a pen, let's dive in and create a home that heals. Good morning, everyone. Welcome back to another show of Homes That Heal. This morning, I'm joined by Dr. Eric Cornelius. Good morning, Dr. Cornelius. How are you today?
I'm doing great. Good morning.
Fabulous. So this is a conversation I am so eager to have and dive into. This is something that I'm very passionate about. The whole conversation around the dental industry, our mouth health, and why it is so vitally important to our health, and why I've often referred to our mouth as kind of the general manager, if you will, of our nervous system. So you and I had a delightful rapid fire conversation last week at the biohacking conference, and I was hot to trot to get you on my schedule because I wanted to continue the conversation. So again, thank you for joining me this morning.
Thank you for having us.
Yeah, I'd like to kind of first start with just, tell me how you found this industry and why you're so passionate about it. A little bit about you.
A little bit about me. That is a loaded question.
Yes.
So I actually started down the medical pathway years and years ago. And as started moving down that pathway, one of the things that really was discouraging to me about medicine was how siloed it had become. And you quit treating the patient and you started treating a chunk of the patient. And that was never really my intention when I went down the pathway for medicine. And it was very demoralizing. And I had a friend in the dental industry who was very encouraging to me to cross deck over into dentistry and be like, hey, we still treat the whole patient and we have the ability to treat what we see. And if you want to move down that pathway, you have that ability in dentistry, where most of medicine you don't. You are very, very restricted. I think that in some ways that was a little bit of a misnomer, and because of my education, I think that the functional medicine side of the house really does treat the whole patient. But from the allopathic concept, nope, it's very, very siloed. So that was a massive change that happened for me, switching over to dentistry, and really that focus on being able to treat the whole patient, being able to treat children, adults, grandparents. It's kind of that old time family practice doctor concept still lives in dentistry, where that has been lost in most of the rest of medicine.
Yeah, that is a very interesting point. I know you're a huge family man.
Yes, I have 8 children.
Yeah. So tell me exactly. I think that's one of the things that I think consciously, we're kind of moving back in that direction a little bit, as far as where people want to get back to a little bit more of the connection in that community, and having the old time doctor, if you will, or someone that's really treating the family and looking at it as a family unit. So I know family and mission work and a lot of this stuff is very important to you, which is, again, why I wanted to talk to you, because I think you bring more to the table as far as the scope of practice. So tell me a little bit about, first of all, I'm intrigued about how you grew up. Do you want to share a little bit about that? Like, I was reading about you and it was like farming. So your mom, like all the classic family value stuff. So you have to share a little bit about your upbringing and the bees. I think I have to mention the bees.
Okay. So, I mean, I'll go on bees because I love bees. And this started for me I think I was third grade, and a swarm of bees ended up landing on the fence post out in front of our house. And I was totally infatuated with the bees at that point in time. And a local beekeeper ended up showing up, collecting the swarm, and leaving. And that started this process of like, wow, these are the most awesome thing since sliced bread. And I started reading tremendously. I was homeschooled at a very young age. It's actually the first year it was legal in Oregon when we were homeschooled.
You were being homeschooled when it wasn't popular, right? Like,
Oh,
it
no,
was
not
not
popular at all.
not something yeah, not a thing. Well, it was a thing, but it was a quiet thing, right? Like, it wasn't something
Yeah.
talked about much.
Yep. We were going to be socially awkward, incapable of functioning with society or any people. We would really need to live in barns or in caves because we couldn't interact with society. We weren't going to have any understanding or knowledge. We're going to be these weird, eccentric individuals. So, yes, all of that to say, one of the characteristics of growing up in my home as a homeschooler way back when is that we went to the library every single Wednesday for about 4 hours every week. And I read thousands, if not tens of thousands of books. And one of the groups of books that I read was every single book on beekeeping that our library had. And this is kind of weird to talk about, not so much for you because you're old enough to remember this, but with my children, the concept of not having Google, they can't even fathom that. Right. So if you want to know something, you just ask and it's right there. But this was back before that concept. So if I wanted to know something, it had to be on thought of before Wednesday. I would then go into the card catalog, look up the book, go find the book, search out that book. And then our particular library did not allow more than 3 books of a particular niche genre to be checked out at one time, which I understand. Keep somebody from wiping out all 12 books that they have on whatever it is: organic farming, aviation mechanic, beekeeping, whatever. And so you could check out 3. So you sit in the aisle, you pick the 3 that you believe are the best 3 that you have, and then you go home and you pore over them and read them. And then you could change them out each week. So that's how I got into beekeeping. I started reading about it. My dad was in the timber industry. And so we started building beehives in our garage. And so we spent, I think it was a better part of the year, and I built about 20 beehives in our garage. And then we started collecting swarms and bees. And we lived on, I think it was about 1 acre. But as you walk through all of the processes with the different seasons and different blooms and flows, and then at the end of the year, you get to harvest honey, which is absolutely the most rewarding things ever. And so then having this honey that you helped function from start to finish. And that was really phenomenal. And that was one of the early steps of kind of, I guess, homesteading concept.
Yeah.
But gardening, raising rabbits, raising sheep, raising bees, that was how I grew up. My mom used to really get very focused on in the spring of how much can we live off from our own property. And so sometimes you eat some weird stuff because we got 600 pounds of zucchini and not a whole lot else. No, you're just kind of those focus. But it was a great way to grow up. It was a very fun childhood.
Yeah. Oh my gosh. I think how classic and beautiful that is. And I am old enough to remember all of these things that you're talking about before internet. You know, you and Cheryl were chatting about that a bit too. It's like we didn't know internet and the capabilities of it and the benefits of it are great. Like there's so many benefits to it. We've evolved so much because of it. But I'm so grateful for the childhood that we had not having the internet. So going back to the homesteading, growing your own food, you know, getting back to basics, family dinner, spending time out in nature, just all of those things and being curious. And then of course the library. I don't even know how many there have been quite a few people we've been talking about the library lately. Like you had to get an idea, go there, index cards, find the book, read the book, gain the knowledge. That process is so far lost and gone. But how interesting. I love reading my home and my office, my everywhere around. I'm usually reading like 3 or 4 books at a time. I don't know why. Are you the same? Do you do that as well?
Yes.
Like, I know it's
Or 5 or 10.
so interesting. I don't know if it's just the mood I'm in or I'm just like excited to read and be curious about different topics, but actually reading the physical book. Now, I'm an Audibles person, so I don't mind it in the ear once in a while. Like I like to listen to podcasts and things on the go, but there is something to be said about finding a good book and sitting down and actually absorbing that information and that knowledge. And so I'm definitely a reader. I loved going to the library. And I think that's one of the things that, again, I was interested in speaking with you because you're also very focused on learning, like learning new information, not just taking the information that you have and saying, okay, this is it. It's this constant evolution of learning and soaking it in. I'm curious about, so let's kind of switch gears into the dental piece of it a little bit. What have you learned, I would say, in the last 20 years? How has the dental industry changed? And what do you see? I guess, first of all, is our mouth is very important health component. What has changed in the 20 years that you've been in the industry? I guess, what is it that you've learned the most?
I could talk for a week on what's changed in the last 20 years.
I feel like that was a really big loaded question. I'm sorry. You answer it however you want.
That's fine. I want to talk about, we'll start with the thing that I see as the biggest change for me in the last, and I actually just learned this in the last year, and that's really TNJ dysfunction. And so jaw joint dysfunction from when I was originally going through TMJ treatments and help, we really didn't have any middle ground. It was anti-inflammatories, take ibuprofen, eat a soft diet, give it 2 weeks and see if it resolves. And if not, then send them to the oral surgeon for evaluation for jaw joint replacement. That was it. I mean, wildly separate options for what to deal with. And recently, I've taken some courses, again, very holistic focus, Dr. Judson Wall's courses on holistic dentistry. And really, prylotherapy is a new aspect that is opened up for DNJ treatment. And in essence, what you're doing is you're drawing blood, you're spinning it down, you're collecting that protein rich plasma, injecting that back into the jaw joint, and then following that with some ozone. And so you're re-stimulating all of those chemo factors, all of those chemical factors from our blood that say, come heal me. And what we can do with that is we can end up with some cartilaginous growth. We can potentially end up with some bone growth. I mean, it's really, really quite amazing. There's a lot more to it, but I'm going to boil it down to that. And that gives us a whole lot of middle ground. I mean, drawing your blood and shooting in the chemo factors is much, much easier than saying, go to the oral surgeon and have them cut off your jaw joint and replace it with a piece of titanium.
Yeah.
That's a big commitment.
That's like,
Yes, yes. So that to me is one of the largest massive changes that I've seen. Ozone has been something that's been fabulous to add in to my arsenal to be able to treat. I mean, shoot, you can treat bacteria, viruses, fungus, all hate ozone, which is fabulous. They all die. And then on mammalian tissue, we treat inflammation, increase healing, increase circulation or blood flow. Short of the lung tissue, pretty much everything inside the human body loves ozone. So that ability to treat selectively, our tissue loves it and all the yuck doesn't love it. That's very, very awesome. That's another thing that's been awesome to add to the arsenal and armamentarium.
yeah, wow. That's definitely an example of something that has completely evolved. And that's a beautiful change in the evolution on how you can treat a situation versus cut into the body, right? Like completely something that is quite invasive, actually. So that leads me kind of to, do you want to chat about, I know we talked a little bit about one of the speakers at the event last week. It reminded me about our conversation about jaw health. And one of the most impactful things I saw last week think James Nestor, I think, was actually the speaker, and they were talking about how our teeth and our jaw lines have evolved and changed over the years. And I can't quite remember the time span of it. I think they were looking at like a couple hundred years, obviously, but just how the human face and the composition of our jaw lines and our mouth health have changed and how that affects teeth placement. Because I think, especially for kids in the last generation or so, more braces, more issues with teeth, more things going on with the mouth and the teeth, kind of, I don't want to say jumbled up, but I can't think of a better word for it right now. But just how is the change? And I know we touched a little bit on like breastfeeding and some different things. Do you want to speak to that a little bit? Because when I know when I brought that up, you like lit up and you're like sat down. We had this whole conversation. I know we don't have time for all that today, but I think it's really important, especially for any parents listening, how this has changed over the last 20, 30 years.
Absolutely. I didn't specifically hear him speak, so I'm not going to be speaking directly to what he
I
said.
no, I brought it to your attention and you were like, "Oh, tell me more. Like, who is this guy?" Yeah. His name was James Nestor. Beautiful conversation. His focus was on breathing. He's got his expertise in wheelhouse is breath work, breathing,
Mhm.
how it affects the body. He was teaching us how to properly breathe and not hold our chest, but also what it's done to the nasal cavity and how it's
Absolutely.
affected our mouth. But then we have, he was talking a bit about how our mouths and the structure of our faces have changed. And so that's how you and I got into it, because obviously you're working in the structure of our face.
Yes, and here's a funny. I'm going to go one little direction. I'll come right back to it. So, how things have changed, and you talk about structure of the face. There was an orthodontic paper that was published, and I believe it was in the '70s, where they did not want to treat the vaulted, high arch, vaulted maxilla in early age, like 3 to 5 to 7, because it would make the nose too broad, and they felt that that was an unattractive thing to do, which, in my opinion, moves us right back to me foot binding. We make a decision that this is what we call attractive. Therefore, we're going to pinch the airway of these children for the rest of their life because we think a little tiny nose is cute. And so that's in essence what they made that decision. That's been completely flipped on its head, particularly in the last 20 years. And now that concept of opening the airway, opening the nose, opening the maxilla has made a huge difference. And it's a concept and a direction that we're going. One of the things that you can look at that, how many people in their 40s, 50s, 60s, 70s that had orthodontics had four premolars extracted? Almost 100% of them. Now, it is pretty rare to be getting patients that have four premolar extractions. Not unusual. I'm not going to say it's unusual, but it's way, way lower. And I expect that that'll be going down even more as we move forward over the next 20 years. Because these are concepts, and you go back to that time frame, that's when we were looking at, can we straighten the teeth? We didn't care what the head looked like inside, where the teeth were inside the head. We're dealing with the teeth, not the head. And now that's totally and completely changed. One of the concepts that we look at when we're looking at a patient before we do their treatment is, it's called a lateral ceph, which basically just means side head. In essence, the head is turned completely sideways, an x-ray is shot, and then we look at that image of the side of the head, and we're looking at four characteristics in that. We're looking at the jaw on the bottom, we're looking at the teeth on the bottom, teeth on the top, jaw on the top. And we can have a defect in any one of those four areas. We can have a deficient mandible, deficient mandibular teeth, deficient maxillary teeth, or deficient maxilla, or any combination of all four of those. What's ended up happening is the maxilla particularly is being deficient. And that's where we have the floor of the sinus and our nose and the roof of our mouth. And a lot of the reasons for that is because of the lack of breastfeeding. There's really a huge issue with that. Breastfeeding is harder than using a bottle, period. There's no ifs, ands, or buts about it. And you get bigger muscles when you do harder things. You have better ligaments, tendons, and bone structure when you are a physically active individual. We're restricting that down from the whole body, just to the tongue and the roof of the mouth, floor of the sinus. When you go from birth to 2 years old and you say, hey, we're not going to work for the first 2 years of your life. And then we turn around and go, oh, you failed to develop the bone structure and the muscle development and the myofunctional therapy or habits we would expect to have happen. Shocker? No, not really.
No.
And so that is a huge aspect. And I think it was 2 years ago, there was a research article that was published where they stated if somebody breastfeeds solely for 2 years, they have zero obstructive sleep apnea as an adult. That's phenomenal.
What?
Exactly.
Oh my
Exactly.
gosh. Oh,
So,
wow. That's huge.
and those are massive changes from 60s, 70s, 80s when we were saying, oh, breast milk, it's not that good. You should really be using this scientifically formulated formula where we've got all of your vitamins and minerals and energies, your fats and your sugars, and which we now know is totally and completely horrible for you. But at that point in time, that was what they were feeding everybody. And you shouldn't be, I mean, this old, outdated, natural stuff should be done away with. We want to ship you into a hospital. You'll give birth there. We'll then feed the child with this formulated substance, and all of children will be better. I mean, it was the era of the Jetsons. So,
Yes, it absolutely was. But when you say it now, I mean, now that we're kind of flipping all of those things on its head, basically, why were we messing around with what God had already given and created, right? It's just, I mean, it's almost, you can't even put words to it, especially when you describe it to like kind of like flexing that muscle, working the body, strengthening the body. That's a beautiful analogy. So thank you for that. But also just the nutrients and the mother baby connection, the nutrients from the mother, like all of that, as well as strengthening those muscles. Oh, it's just an interesting evolution. I'm grateful that these studies have been done and people have looked into this and they're starting to move away from like it's certainly one of those things where looking at what's actually in the formulas, not so great, obviously, as well as nowhere near the capability of what the mother can produce, right? Now, obviously, I get incensed if if there's a situation where a mother can't do that, like that's a extenuating circumstance. I also know a ton of mothers who donate their milk, and there's all these different beautiful things that you can do. But what a concept to think that something the mother can provide. So very interesting. So let's switch gears and talk about the mercury fillings. I'm curious why mercury was ever brought into the dental industry in the first place, because it's now clearly kind of moved away from. But where are we at now with it? I think maybe somewhere 10 to 20 years ago, it was realized like, oh, maybe this isn't the best component to put into our mouth. As this is personal to me, this is where my metal toxicity came from about 15 years ago. I discovered I was overloaded and toxic with mercury. I flew out to California, spent some time at a conference, and I met Dr. Huggins. He's the one who introduced me into the holistic dental world. But I specifically saw a doctor there that showed me the vaping that was going on inside my mouth, and it was alarming. It completely changed my life. I want to give you the floor on your thoughts with this as well.
so there's a lot in that. For starters, we have to go back to, I mean, you're asking, why was mercury ever put in here? So let's walk all the way back to G.B. Black, who is considered the father of modern dentistry. And we're talking Civil War. So 1860s-ish, give or take a little bit. So when you go back 150 years ago, I want you to think about anything that you would still consider cutting edge that was cutting edge 150 years ago. Nothing. There was nothing that was cutting edge at that point in time. So the fact that we brought mercury in at that point in time, is it shocking to me? No, not at all. Not even sort of kind of. One of my professors had a serious love affair with these old dental books and used to put quotes up before lectures. And it was an absolute riot of different things that we would read from these textbooks from like the 1880s, 1890s, where they would say things like, to be an effective dentist, you must have 2 candles in the room where you do dentistry because sufficient light is a necessity. I'm sorry. That is hilarious to me. Because if you've ever tried to read a book with a candle, I mean, it's almost impossible. And you think two candles, we're now like, this is like this incredible, expansive volume of light. I mean, it's so humorous to me. I have a light on my forehead, which is probably somewhere around 750 candle power running through a lens. And then I had two telescopes on my glasses. So this is all focused within the size of a racquetball. I mean, it just, the concept of dentistry is so different than it was 150 years ago. It's just insane. So, was mercury our only option back 150 years ago? I don't know. I didn't do chemistry 150 years ago, but maybe it was. I really don't know. For all intents and purposes, if you are a proponent of amalgam, you call them silver. If you are an opponent of amalgam, you call them mercury.
Mm.
Both people are right. It's basically 50% silver, 50% mercury. And then there's, say, somewhere between 3% and 9%, which is everything else: copper, zinc, nickel, all the other little
And
tiny
yep.
pieces. So we're going to ignore those other percents. We're just going to call it 50% silver, 50% mercury. Was that our only thing that we had 150 years ago? Yeah, it probably was. So 150 years ago, was an amalgam filling the best option we had to keep the tooth? I don't know. I really genuinely do not know. So fast forward up until somewhere between the late 50s, early 60s. That is when we came out with silicate fillings. So this was our first concept of a composite resin restoration. These were ridiculously difficult to do. So you think about doing chemistry, this really truly was doing chemistry. The doctor removes the decay from your tooth. You're sitting in the dental chair, and he turns around and does chemistry behind you for about 20 minutes. After he's made this chemical concoction, he then turns back around and packs it into the tooth and then holds it for 20 minutes while the chemistry happens and this hardens up. So, yes, whoa is a very good answer to that statement.
Hmm.
So, if you go in for a filling, you're talking not just the work that was done on you. We do the work to remove the filling, remove the decay, and then sit there for an hour. Half hour doing chemistry, 20 minutes just holding this, waiting for it to harden. It's the same concept as pouring a sidewalk with concrete, but it's inside your mouth. And we're waiting for this to harden. And then after it's hardened, then we could polish it and finish it. So the concept of going in for a front tooth could easily be 2 hours long. I mean, so this was something that was, it's not a replacement for the amalgam filling. So we're late 50s, early 60s. These silicates, an hour and a half. An amalgam restoration, 6 minutes was the length of time from when you place that until it's hard enough that we could carve it. I remember that number because it was a dental board test question. But anyway, so 6 minutes versus 2 hours, there's no comparison. And so the reason behind that, you couldn't even go that direction. And then secondarily, these composite resins, these early composite resins were super sensitive for moisture, where an amalgam could be placed in a very wet environment. So again, we would have a fail rate that was through the roof. Those early composite resins, I mean, I moved into dentistry in the early 2000s. At that point in time, we were still dealing with those first, second, third generation resins, and they failed all the time. You're expecting a life expectancy 1 year to 3 years was normal. Not what you wanted, but it was what you
Wow.
saw. Exactly. Whoa. I mean, can you convince somebody to do a resin restoration when it's not going to last but a year to 3 years? Maybe 5 years would be a good treatment. We don't see that anymore. Now we're seeing resin restorations that are lasting 3 years, 5 years, 10 years, sometimes more than that. And so our length of longevity is much, much longer. So somewhere in that time frame is really where I see amalgams were outgrown. Now you also saw mercury had toxicity issues, and we quit dying at the age of 20, 30, 40. So you go back to the 1860s, 1870s, 1880s, we didn't live very long. So you get a amalgam restoration. Were you getting mercury poisoning? Yes, you did. You die of the mercury poisoning? Probably not. Probably died of something else. And so we weren't living long enough to have that actually be an influence on our life. Was it the healthiest thing for us? No, no, it wasn't. Was it the healthiest thing that we had available? Yeah, probably. So they did end up with gold foils happening, and I'm not exactly certain when that came on the scene. I think that was somewhere post World War II. And that really survived all the way into the gold foils died with the gold influx that happened.
Mm.
I think that was 2008 when gold went from $350 an ounce to $2,000 an ounce.
Yeah.
Yeah, dental gold is what basically whatever the cost of gold is times about five.
Wow.
So if you're paying $350 an ounce, it's about $1,500 an ounce for dental gold. If you're paying $2,000 an ounce, you're paying about $10,000 an ounce for dental gold. So and I think it was 2008 is when gold prices just took a
Yeah.
serious jump up. And at that point, gold stopped being used in dentistry because going from a crown that used to be, say, my lab cost would be $300, and now my lab cost is $2,000. So
Yeah.
your cost for getting a gold crown could be three, four, five, $6,000 for a gold crown. So they just went away. And that's when ceramics really came in, which I think is fabulous. We have lithium disilicate ceramics and we have zirconium ceramics. They serve different purposes and they do amazing things. But that was another area there. So back to gold foil, where you take these little pellets of gold and you're heating them and then you're compressing them and forcing them in. That was an alternative to amalgam. It was a very expensive alternative, obviously. Amalgam is extremely inexpensive. Gold is not inexpensive, but it was something that came up as an option for people who are like, no, I don't want mercury fillings.
Mm.
I was a little late in that game. I did not practice dentistry in the 60s, 70s, and 80s. So I am not a gold foil. So I'm just giving you the history on that. And then we move into the more modern composite resins. And composite resins, again, super finicky, super picky. They did not like moisture. They did not like touching the tissue. There were just lots of things that they threw fits about. And so we had limited success with them. Late 90s, early 2000s, they came up with a new chemistry, which is called a glass ionomer. And so with glass ionomer composite resins, they had the ability to deal with moisture. And that really, in my opinion, was when we truly could remove amalgam restorations from our palate completely. Because with a glass ionomer, we could treat at the gum line, we could treat in a high moisture content. And you think about it, everything in the mouth is a high moisture content. There's
Mm.
no place inside the mouth, which is amazingly dry and clean. So we're, say, the side of a second molar or the side of a wisdom tooth. We're doing a restoration back there. That was a classic area to place an amalgam restoration. Now we could place a glass ionomer. So this progression as we move further and further along and we remove more and more requirements for doing amalgam restorations. Though another step in that was our bonding techniques that we had, and then also our matrices systems. There was a matrix system that came out, I believe it was 2005, called the VRIN, and it was the first great composite system to give us contacts in the back. So prior to that, if you got a composite restoration in the back of your mouth, you wouldn't be able to, I mean, you could floss between it. It didn't touch. You get
Mm.
packed carrots and chicken and roast beef would all get packed in there because it wasn't tight and there was no method to make it tight. After 2005, that's when we really had great systems there. So I've given you a ton of information as we've walked through the last 150 years, but now we really have, in my opinion, if you have a dentist who takes great care and pride in what he does, you can get phenomenal, high quality posterior resin restorations that last a long time and give great function to the patient.
Yeah. No, I appreciate all the history. Like I said, that's one of the many reasons why I wanted to chat with you is because I knew you were going to be able to walk us through not just current statistics and data, but how this has moved over the last. I actually didn't realize this was 150 years old. I was thinking it was like early 1900s, maybe. I probably should have researched that more before we chatted, but I didn't realize it was back to the 1800s. That's pretty crazy. You mentioned something that I want to touch on a little bit before we sign off today too. One, just any health related, like common health related issues that you're seeing, whether it be disease or just autoimmune, things like that. And then let's also talk about for those that want to do amalgam removals, what that smart process is. I know we chatted a bit about that.
Absolutely. So dental hygiene, it is a cornerstone of health. And let's actually move to the systemic first, then we'll go back to the hygiene. Your mouth is the gateway to your body. Around your teeth are unique in that they're the only part of our body where we actually have a protuberance of our bone or a bony structure that sticks through our skin. And so we have an area where we can allow bacteria a, a pathway into our body. And this is one of those things that comes up a lot where we talk about pre-medding for heart or joint issues. And that is something that's a whole nother conversation, but we'll just say every time you go through a dental visit, you end up with a systemic bacterial load. That's not the shocking part about it. Anytime you eat, you end up with a systemic bacterial load. So whatever the gross that's in your mouth, it's going to get kicked into your bloodstream every time you consume anything. So, yes, it's true that it happens during a dental visit, but it also happens when you eat a piece of toast. So, if you want to have a healthy body, then you're going to want to have a healthy mouth. One of the areas where this is absolutely phenomenally important is with the gums, which is what we would call periodontal health, peri around dental tooth. So it's around the tooth health. And then also decay. So those are two areas that we see most of our disease happening. They function in two different directions. Periodontal disease is generally caused by bacteria that focus around the tooth. So around every single tooth, if you think of like a turtleneck sweater that wraps around your neck, the gum tissue wraps around the tooth. And so right around that turtleneck sweater is the interface between your body and your head. And right around that gum tissue is the interface between the outside of your body and the inside of your body. So when you go to the dentist and they go and measure around each of these teeth and they yell out these numbers as they're going, it's normally done by the hygienist. It's like 1, 1, 2, 2, 1, 2, 1, and sometimes they're not those good numbers. They could be 3, 4, 7, 2, whatever. And so they're giving these numbers. 1 through 3 are healthy numbers. 4s and above are non-healthy numbers. So what that's telling us is how big is this gap in that turtleneck around your tooth. And if we have crud inside our mouth and we have blood and organs and all the stuff we want to take care of inside, we don't want a big old gap where that crud is seeping in. So the tighter those numbers, the better off we are. Inside those areas, we have all kinds of bacteria. Even when we're healthy, we have all kinds of bacteria. But when we're unhealthy, we have tremendous amounts of bacteria that get down under those gums. And then when we do anything, we eat a chip, we eat toast, croutons, anything that's rough and hits the gum tissue, it's knocking bacteria free that then goes into the lymphatic and ends up inside your bloodstream. So having healthy gums is incredibly important for actual whole body health. We have seen it with kidney health. We've seen it with heart health. We've seen it with pulmonary health. I mean, it's almost ubiquitous. If your teeth are a mess, your body is going to be a mess. So having regular care where they're getting in and cleaning that, but we can't. I do support regular care 100%, but it is 100% also on the patient. If you aren't going to take care of your teeth and you don't brush and floss and you don't choose wise food, there's nothing your dentist can do. I mean, they can just watch your ship sink, and that's all we can do. I hate to say it, but it's true. If you walk out of my chair and you eat anything you want, you don't brush your teeth, you don't floss your teeth, and you come back to see me 3 months later or a year later, it's not going to be good. It's going to be horrible. So having impeccable brushing and flossing care is incredibly important. And then let's switch over to food choices, because we're going to switch from periodontal disease, which is mostly about brushing and flossing and keeping impeccable oral hygiene, to tooth decay, which most of tooth decay is function about your decisions on what you choose to eat. Sodas, fermentable carbohydrates. Those are the two that will absolutely destroy your mouth. If you could decide to create something, you're going to sit in a lab and you're going to, I want to make something to destroy teeth. You would create soda. That's what you would create. High sugar, high acid. It's available everywhere in the world. You have alluded to the fact that I enjoy doing dentistry all out throughout the world, and I do. And I have been in villages throughout Africa where we do not have electricity, we do not have running water. But what do we have everywhere? Coca-Cola.
Oh, I knew you were going to say that. I knew I worked for Coca-Cola for 15 years, right? Did I tell you that?
Did you?
I was going to say, I knew you were going to say Coca-Cola, but yeah, I worked in HR and administration for 15 years before I got into this industry. But yeah, one of the many reasons that I got out of that business or out of that profession was when you start to learn what's in that stuff. I mean, I got that job when I was 19, right out of high school, went into college business. Like I was excited. It was a great opportunity and I loved it. Don't get me wrong. But as I aged and got a little bit wiser, as well as keyed in on my own health and well-being, and I'm like, what is this stuff in a can that can take rust off a bumper? What is this stuff? Like, why would people be consuming? And I have to say that I was never, we didn't grow up with soda, actually. We were allowed and it was like a treat growing up in the 80s and 90s, I suppose. We didn't drink soda, but if we had like a Friday night, pizza night or something, we were allowed to share a soda or allowed to have some soda. So I didn't grow up with a family of soda. I wasn't a soda drinker when I worked there. I drank water or tea, but most people at the company, as well as obviously the world, love Pepsi. People are addicted to it. It's the sugar. We all understand the components of it, but the damage it's doing to the mouth as well as internally is beyond. So I'm going to throw the baton back to you on that one.
Yes, and I'm totally not talking about your metabolic health. And I know that that's literally me taking one little tiny piece off the elephant and pushing the rest away. But yes, and there is a lot of metabolic issues. And I think Dr. Lustig, sugar is a poison. If you want to diving into that, that's phenomenal. But I'm not going to touch on that just because I'm talking dental.
Mhm.
So with sugar, when you consume sugar, and sugar is an entire family, but we're going to specifically talk about one sugar, and that's sucrose, because sucrose is a 6-chain sugar and a 5-chain sugar connected together by a high energy bond. That high energy bond is what is needed by a single bacteria inside your mouth called Streptococcus mutans. So when you consume sucrose, sucrose gets into your mouth. It is ubiquitous everywhere. The Streptococcus mutans grabs onto that. And with that sucrose molecule, it busts that sucrose molecule in half, takes that high energy bond, uses that high energy bond to glue itself to the side of your tooth. So you talked about how God creates in a phenomenal structure of our human body. The enamel is incredibly hard and it is very difficult for foreign substances to stick to it. But sucrose and Streptococcus mutans, they have found a solution for this hard shell, and they can stick themselves to the side of enamel. And once they've stuck themselves to the side of the enamel, then they can sit there and metabolize sugar and discharge acid and start to chew a hole right through the side of the tooth. And that's in essence all a cavity is. A cavity is bacteria eating sugar, discharging acid, and eating a hole through your tooth. So there you go. That was 4 years of dental school in 90 seconds.
Love it. Again, no one has ever explained it like that. Perfect analogy. If the soda companies, interestingly enough, they were able to create something that could actually break through that barrier of the enamel and actually cause this type of issue. I'm curious, one of the things I wanted to ask you about is you said we were talking about the sugar conversation, and you had mentioned that you traveled the world. Obviously, you spent one of the things I think is interesting is I read that you spent 6 months with a tribe in Kenya. And I mean, obviously, I don't know that we have enough time to go into that today, but anything that you want to share about what you're seeing in different cultures when you're traveling outside the United States, particularly into the wilderness of Kenya and spend 6 months working with a tribe?
I mean, they suffer from the same problems we do in that you want to have things that make you seem prestigious. And so when you have the ability to buy sugar or a processed substance, it is a sign of prestige. And this is actually something that didn't happen in Africa. This one happened in Nicaragua. I was working, taking care of some kids and their decay. And this was a young girl. I think she was 14, 15, somewhere right in there. And she had decay right between her two front teeth. And it was bad. It looked like a BB sized black hole of decay right through the two front teeth. And I did two fillings on her. I took out all that decay. I rebuilt her teeth. They looked really nice when I was done. And she was so mad at me. She was absolutely furious at me. And my Spanish is so so. So I ended up asking the translator, I was like, what in the world is going on? And he talked with her, and then he turned to me and he goes, the issue is that having your two front teeth rotted out is a sign of wealth because it means you have enough money so that you can buy a soda every day and they drink it through a straw, blasting their two front teeth so that they can rot their two front teeth out as a this is on the front of my face to tell you I'm so wealthy, I can burn money with a soda every day of the week. And so I took her, I don't know women's handbags, but I took whatever the women's handbag that is a sign of wealth and prestige, and I took that away from her when I fixed that decay. So this is one of those hard concepts is that when we consider that which destroys our health a sign of wealth and prestige, it's very hard for us to walk in and tell you to stop doing it. I mean, there's nothing more difficult than changing social pressure. I mean, that's really, really phenomenally hard. I doubt I saved her any long term help because she was mad at me. She probably went out and grabbed a soda and started drinking again. And within a year, she had those cavities back again because it's a mindset. I mean, it's not really any different in our country. Nobody looks at somebody with a big gulp soda and thinks, wow, you're destroying your life. I grew up in the 80s where smoking was cool and hip. It's like, and it was that power alpha male sort of thing to now it's like, well, they can't get out from that addiction. I feel like that transition has happened, at least in my eyes, over the last 30, 40 years. That has not happened with soda. And until we see that change, when you see somebody walking around with a soda and you say, they can't get out from under that addiction, we aren't winning.
No, no, we are not. Unbelievable. I had no idea that that was a sign that a person would wear that on the front of their face as a sign of success or just like wealth. Like that's mind blowing to me. That's so sad. That's so sad, actually. Okay, I want to be able to come back to the amalgam, the mouth restoration. As I said, it was imperative for me to remove the 4 mercury amalgams that I had in my mouth so that I could move through the detoxification process and extract the mercury out that had kind of crossed the blood-brain barrier for me. It's very passionate and purposeful for me. That's one of the many reasons why I do this work, actually, and why I stepped into this. It's how I got into the infrared sauna, light energy detoxification world. For those that want to remove, I know this might be a loaded question and I don't even know if you can answer it, but I'm going to throw it at you because I think you can probably handle it. But how does a person know if they need to remove these? Like, is it kind of a straight laced, if you have them, you should consider removing them because the health issues and implications are not in your favor either way? Or what are your thoughts there? And then, of course, kind of walk into you're a certified smart dentist, or what, explain what that means to people versus just going to a dentist who's like, yeah, I can take that out of your mouth.
Absolutely. So I'm going to start first with if you have them, should you get them out? If you're talking about optimizing your health, my answer is yes. Is it actually giving you any health degradation? I don't know the answer to that. There are different ways you can do that. You can test for mercury buildup in your body. Every single human being falls into one of three categories. We're either tolerant, we're moderate, or we're sensitive. I don't know who you are as a patient or how many amalgams you have in your mouth, or have they been changed out 1, 2, 5, 10 times? Those are all factors that come in here as well. Ways to test, is this giving me problems? Would be going to somebody who has the capabilities of doing a neurologic test on that. So if you came into my office and you were like, I don't know if not even talking about mercury toxicity, but talking about potentially the metal blocking the energetic movements and things like that, how can I even test? I can do a neural test with that around those restorations, and then we see how you function for the next 24 to 36 hours. And if you walk away and you're like, oh my goodness, my right wrist feels a ton better, well, that right there is a show that we have a non-oral manifestation of an oral problem. And so that would be a way to do it. So that's one way that you can do a neurologic testing. The other is you can just say, hey, we know these are not optimal. Let's get them out. And then as far as, can any dentist take out a mercury restoration or an amalgam restoration? Yes, they can. Are they stacking the deck perfectly in your favor for you to have the best health outcome? We are not taught that in dental school. So unless you're going to somebody who has learned that outside of dental school and focuses on it and it becomes a significant deal to them, if you're doing it for health reasons, I would choose somebody that has focused on that. So some of the big areas that are important is that they drape the patient. So anytime we're working on this, we're going to have little pieces of that metal getting mercury all over your body. You can't wash it out, so it's stuck in your clothes. So you want to be draped. You want to be draped with a drape that is non-permeable. So that drape, they drape you with it. Then they also cover your mouth. So that's a rubber dam that we're putting around that. I also put a drape completely over the head. So if you think about going in for surgery and they drape your whole entire body except for that little piece that they're working on, that's in essence what I do to the patient. Underneath that rubber dam, I place a suction because a mercury vapor can travel through a rubber dam. So even though we have a barrier, it can still travel through that. So then we have suction underneath, it's vacuuming that away. And we also put oxygen in your nose. So I have you breathe through the nose. So you're breathing oxygen instead of breathing anything that gets underneath. I have a high volume suction that's right outside of where I'm working. I use high water, so it's being encapsulated in that water and vacuumed away. Then we turn around and we place a high volume vacuum unit right underneath your chin. So all that gas is being vacuumed away. And then that has a mercury filter in it. So it's capturing that mercury, not discharging it back into the rim. Everything that's being vacuumed up is going into a amalgam separator. So it's capturing that mercury and keeping it outside of the environment. So that's what I set up for you. And then for me, I'm also draped, and then I wear a mercury respirator. So I look kind of like I'm, working on fiberglass on boats, but that's what it is. Dentists have about 5 times higher neurologic toxicity than the general population. Coincidence? Maybe, but I don't think so. I'm working hard. Yeah, I agree. So I'm working hard that I'm not breathing that vapor either.
Yeah.
And then after we're done with that, we clean everything up. We wipe it all down with a mercury capturing substance. We clean everything. We remove all the instruments and reset the entire room so that we can come in with clean instruments and then refill everything. So
Wow.
that's my process. And I didn't come up with that. There's the Protect protocol, the SMART protocol. Dr. Huggins is basically the father of all of these, but that's what we do to protect the patient and our team.
Thank you so much for walking through that because I think it's really important. Like I said, it's important if you're going to do this, you do it properly, right? Or that you're not putting yourself
Absolutely.
at further risk or further health issues. So thank you for being such a huge health advocate in the dental community. As I mentioned, Dr. Huggins is the first one who kind of opened my eyes to this many years ago. However, so many dentists across the country have taken this more holistic approach or this more optimal health approach to our mouth health. So I appreciate you and I'm so grateful that we've connected. We could talk all day on this, honestly, and it's definitely something that maybe we revisit if there's some more specific areas that we want to dive into, because I think, again, like the general manager of our health and well-being. And so for anyone who wants to connect with you, I know you're in the San Antonio, Texas area, so not everybody can fly down to you. Maybe they will, who knows? I've flown across the country to see practitioners that I, personally love and connect and want to work with particularly, but where can people find you and connect with you if they're interested?
So the name of my office is Nautical Dental, and I do practice in San Antonio. And my office phone number, if they don't want to go online, is 210-499-0009. And so they can
Yeah.
kind of get information that way as well.
Perfect. Yeah. Any other information, we'll certainly provide that. So thank you again, Eric. I appreciate you so much. And we will definitely continue the conversation.
Thank you. It's been great.
Okay, friends and fellow wellness warriors, thanks for tuning in today. If this show was helpful and inspired you, please head over to Apple or Spotify to rate, review, subscribe, and follow us, as well as share it with your friends and family. It's a fantastic way to grow the show, expand my reach, and teach others how to create a vibrant life they love. If you're ready to invest in your health and purchase a Clear Light sauna, hop on over to jenhellerlifestyle.com and send me a note. Thanks again for tuning in. I love you. I'm grateful for you. And I thank you so much for your support. You are the reason I do this work. You are the reason I do this show. And you are the reason I get up every single day with a burning desire in my soul. Cheers to your health and happiness, my friends. We'll see you next week. This podcast is for general information purposes only and is not intended to be substituted for professional medical advice, diagnosis, or treatment. If you think you have a medical condition, consult your licensed physician.